My name is Christina Atchison. I am a clinical academic fellow in the School of Public Health, specifically the Infectious Diseases Epidemiology Unit. And my areas of research are the evaluation of child and adolescent public health programs, and also I am trained as a consultant in public health. Since the COVID-19 pandemic, we've been quite busy in the School of Public Health, but recently we've been commissioned to run the REACT program, which is a series of studies. It's sort of split into two big programs called REACT 1 and REACT 2. And REACT 1 is looking at the prevalence of current infection in the UK population. The second bit of the study, which is the bit I'm more involved in, is called REACT 2. Now that is similar to REACT 1, but we're looking at past infection. So we're looking at the level of antibodies to COVID-19 that are present within the population. REACT 2 is actually a group of studies. So we're initially looking to validate or look at the accuracy of some of the point of care antibody tests that are currently available. And you might have seen some on the market or in the news. A lot of these tests have been designed to be used in a sort of clinical setting. So not by someone at home doing the test on themselves, but in a clinic, either being observed or actually having the test done for you by a clinician. So we need to look at the usability and the acceptability of doing these tests at home. And because you get the result there and then, whether people are happy to interpret those results. So although the tests at the moment aren't good enough to give you an individual result, they are good enough once you've done some fancy statistics to look at overall past infection in the community. We will then move on to the bigger scale study, which will be similar to REACT 1, so 100,000 randomly selected people in the population, which we will ask to do this antibody test at home. So then we can look at past infection in the community. And again, that will be a really useful resource for local authorities in terms of seeing potentially how many people in the population have had antibodies or have antibodies to the virus, and then a plan accordingly. It's important to emphasize that at the moment, that if you've got antibodies, it doesn't mean you're immune. We still don't know, there's no evidence to suggest that having an antibody will give you long-lasting immunity. So it's really just telling you whether you've got an antibody or not whether you are protected from infection, although it is likely that you will be. Yeah, I spend a lot of my time on Zoom calls, still sort of staring myself on a screen, which is fine. The only disadvantage is then I don't want to do it with my friends socially at the end of the day. I have had to make mad dashes to the office or to the laboratory, pick up some of the tests, but generally you can do it from home. A lot of research or epidemiological research, the type of research that we do with modelling and statistics, you can do from home. Imperial's great, and since I've come to Imperial, I've felt very welcome. I felt very comfortable coming out, and I came out straight from the start. I think one of the things that perhaps was different coming to Imperial than perhaps where I was previously, and then also working probably sort of 5-10 years ago in the NHS, was the rainbow lanyard and seeing that sort of visible display of kind of welcomeness and openness. I think that's been really positive, and it's certainly something really small and simple that other employers can do to make people like myself welcome. I mean, things are different now. I noticed in the NHS also we have lots of rainbow lanyards, but when I was starting as a junior doctor, there wasn't that visibility. In terms of my work and my research, if I was being really picky, I would say yes, it's probably had an impact and possibly a negative impact. I mean, I work in public health, but I've also done and still do a lot of work in global health. So some of the evaluation programs that I've been involved with have been in lower middle income countries. Now, to have a career in global health or even academic global health, it's really important to be able to spend some time outside in the field doing sort of field epidemiology. And I have done bits of that, but often for very short periods of time, both for sort of outbreak response. So I was part of a WHO deployment to Sierra Leone for the Ebola outbreak. And also when I was evaluating an adolescent sexual reproductive health program, I was based for 3 or 4 weeks in Ethiopia, Tanzania and Nigeria. But a lot of my colleagues go out and spend 1, 2, 3 years there. In fact, when I was in Tanzania, I was staying with a colleague who had his whole family out there, and he was running one of the statistical units. And I'm married. For me and my wife to go out and be sort of open in that sort of environment, it just wouldn't work. So I've changed the direction of travel, so to speak, of my career, probably as a result of that. So probably it has had a negative impact. Equally, I'm not unhappy where I am. I'm doing great research in a great institution. So I suppose it's how you look at it, but it is something, I guess, to note and reflect on. I think what you guys do at Imperial 600 is brilliant. It's certainly a much more active network than any other organisation I've been in. And I think after the sort of initial shyness of coming to some of the events, it's been really good to sort of meet sort of other people. Also, some of the events end up being sold out, which is, I guess, a credit to the network, but also to the people in that network that sort of come out and try and support it. I mean, I wish it's a little bit of sort of advice to my younger self, really, because I just wasn't very good at this at the start. The longer you leave it, the harder it is to come out, and the harder it is to form good working and as well as social relationships with your friends. The places where I've gotten best with my colleagues, worked for the longest, and then retained some of those friendships have been the places where I've come out early. I think if you don't do it early, it just makes it 10 times harder, because you're either deceiving people or getting yourself kind of mixed up into a potential, well, not lies, but just admitting things, which then makes it a bit more difficult later on. At the end of the day, if you can't be yourself at work, and that is going to be a problem, then you probably don't want to be there anyway, or you would like someone in the institution to address that. A good example is something that happened to me on a Zoom call about 3 days ago. I was in a workshop, and I was sort of faffing with my Zoom and moving around and shouting at someone in the background. And I said, I've got to switch off my camera because, you know, my partner is in her pajamas and, you know, making a scene. So I've got to switch. And then the automatic response was, oh, is he up and about? And it's like, so I think. And then it was like, oh, I'm on a call with 100 people. This workshop is not about me. It's just, you know, oh. So I think the best thing that you can do is just not make assumptions. So just, you know, don't be so sort of heterospecific about things. If you ask people about their weekend or what they do, I always assume people are gay until they tell me they're straight, which is a good philosophy. Is a good way to deal with things. I'm not saying that that's what they should do, but you shouldn't make assumptions about people's sexuality. And I think then that will help people who don't have a sexuality like your own to be more open about it, maybe. I mean, I suppose that the easiest go to all the celebrities that are out in the media, but actually I came across an article in one of the newspapers probably about a month ago, and it's about the mayor of Bogota in Colombia, who is a gay woman. I think she's married. I'm going to say she's married, although I don't know what the laws are in Colombia. And it's just the fact that she is the first female and the first sort of openly gay politician who has a senior position. I think the mayor of Bogota is second only to the sort of highest in office, which is the president of Colombia. And in a country that perhaps isn't known for its sort of liberalism and openness to gay people, the fact that she probably had to break through a lot of glass ceilings and had to suffer a lot of discrimination to get there, I find quite humbling and remarkable. And perhaps a bit, maybe this is being unfair to celebrities. Unlike celebrities, she's a politician and therefore can stand up to people and actually make change. And I'm going to say her name is Claudia, but I can't remember her second name. But she's certainly very inspiring, very open about her sexuality. And in a country, I think like Colombia, representing sort of Latin America, I think that's a really good thing. I would try and get rid of homophobia, or sort of underlying homophobia that probably sort of affects LGBTQ people's everyday lives, but isn't done in a sort of open and obvious way. So you almost can't call people up on it. So I guess subtle homophobia Obviously, the more overt, definitely get rid of that, but also perhaps the sort of underlying kind of, sort of more sort of subtle homophobia that probably exists, the sort of passive aggressive homophobia that exists that is a bit harder to challenge, and still grates and wears people in the community down.